Hi everyone, this is Valerie McGraw from the Myofascial Treatment Center in Malvern, Pennsylvania with another tip of the day. And today I want to go over proper positioning when you're doing a cross hand release on lateral trunk. And this is very helpful for when somebody has an upslip. So you want to use a couple of pillows under the waist to set up, and you want to do it at a bit of a diagonal. So we're going to have you lay with your waist here, shoulder in the opening, and your head on the pillow. I have them bend both knees up, and their feet should be back toward the back edge of the table. And then they're going to straighten the top leg. And the reason we do that, have the other leg down or to the back edge of the table, is her bottom foot is going to create a trough for the top leg. What sometimes happens if you're not careful is if they don't have that in place, their leg sometimes drops back into hyperextension of the hip, which then pulls a lot on the psoas, and it can actually jam the low back and the SI joint. So you want to be careful with position. If they're hanging back, they may have difficulty moving around, and you may have to bounce the pelvis again. So put their leg in the trough there. And then the other thing that I like to share to make this easier is I'm using a stool. If you're comfortable with this, you can put your leg up, and if you connect your elbow to your thigh, all you have to do is rest. We're going to do a cross hand release, connecting with the depth barrier down toward the table first. When we get to connecting with the elongation barrier, if my elbow is connected to my thigh, all I have to do is lean to the right, just an inch or two. That will take up the slack. All right, so in opposite directions, and it makes it so much easier, especially if you have somebody who's high up on the table based on your height. So try these tips out and let me know how it works.